I'm a resident physician in an emergency department. We do see a lot of COVID-19 patients. I think that was the big reason why I wanted to get vaccinated. I think the biggest thing is just putting it out there in education.
Teresa LeGrier, President and CEO, Akron Urban League.
I think a big reason is, there's a lot of distrust in the community.
Hello, my name is Russ Newell with Akron City Council.
Robert Dejournett, Senior Pastor, St. Ashworth Temple, Church of God in Christ.
Carla Chapman, Akron Public Schools, Chief Diversity Officer.
Mr. Ed Bankston, owner-operator of Legends Barbershop.
I've seen it come from all different perspectives. The virus does not discriminate.
Pastor Tryon Boyer from Light on the Hill Black Renaissance Community Development Corporation.
I've heard it from all different aspects.
Brandee Wilkinson, owner of Wilkinson Funeral Home.
You have to consider social determinants of health. Like you have to go back and...
Hello, I'm Judy Hill, President, Akron NAACP.
Seeing like the red line, and you see the poverty lines, unfortunately, you see like the food deserts.
Mr. Daniel, co-owner of Beyond Expectations Barber College.
Al Jones with Al Jones Marketing.
Mrs. Shanika Bankston.
How you doing? I'm Joe Boyer with Black Renaissance Community Development Corporation.
Maceo Smith, lead pastor, City of Joy, Life in Richmond.
My name is Jerry Perrier. I work for the City of Akron. I was semi-retired, but I'm back working again.
Courtney L. Brown, founders and winners and leaders, Masters of Education.
Butcher the Barber, Distinguished Gents Tonsorial owner, Akron, Ohio.
Dwayne Richardson, Senior Program Manager, Akron Urban League.
So making healthcare access, availability, and giving information from credible, trusted resources and allowing that to kind of give those to people and let them kind of decide and have more information to make those decisions.
Excited to host this event regarding COVID-19 vaccination. Myself, Dwayne Richardson, Senior Program Manager at Newell. As we know, beauty shops, barbershops are staples in the community. Therapists, therapeutic, you come to get life lessons, anything you can think of, you get at your barber. You can talk to them, your beautician, you can talk to them about anything. So it's only right that we brought this conversation, this dialogue to the barbershop. Because, it's free range. You can say whatever you want to say without being judged at the barbershop or the beauty shop. So that's why we decided to have this conversation, this talk back about it. And we just more or less want to educate people. We're not forcing our agenda on anyone. We just want to educate our people and just let them know, maybe dispel some mythbusters, but at the same time, just give our reason of what's our why, and why we're vaccinated, why we're not vaccinated. So first question I'll throw out to our host, Mr. Butchie, for letting us use your space. So what's your take or your stance or your personal experience regarding COVID and vaccination?
Well, I ain't gonna say I'm against it, but I ain't gonna say I'm for it. But I'm more with the old school. If it ain't broke, don't try to fix it. Cause I don't know what they doing with that, what's in it for us one, cause they don't even know what the variant is, what COVID is. So it's like, how can y'all make a vaccine for something y'all don't even understand the disease yet or whatever? So, to me, I just, if I don't see nobody just drop dead in front of me with a COVID, a signal that says it's COVID, I'm not going to get vaccinated.
Okay.
You know what I mean? I wear a mask, stay 6 feet or whatever, wear my gloves, or client want me to wear a mask, I'll put one on. But I'm not going to force them to do it, because I think it's on choice.
Right. I think, that's the beauty of it, but anyone else can definitely chime in, just give your thoughts.
Well, I am vaccinated, and the reason I did get vaccinated is because I have a lot of elderly people in my family, and I felt responsible thing for me to do was to get vaccinated. And I also caught COVID myself, but this was before the vaccination was available. So the thing about it is that it's not like a cold or a flu or anything like that, because like one day I was cool and next day I got sick. And it's like, boom, you know, and it's, when you actually catch it, you understand this is real, you know what I mean? You know, it's no myths about it, because if you actually experience it, which I have, it is serious, you know, so I couldn't wait to get vaccinated, you know? So everybody got their own perspective, but that's mine.
And I actually, I know my brother said he had, somebody dropped dead in front of me, but for those of us who have lost, family members or friends from COVID, it makes you look at it differently. I had a couple very good friends who, because of isolation, they did not have the opportunity to go and be with others and whatever, but it seemed to take a different toll on them. And COVID, I mean, literally killed people.
Well, I'm unvaccinated. My daughter, who just got hired by Pfizer, you know, the one that has the vaccination, I found it interesting that they didn't make their employees, it was their choice. So they had a choice to get it, which made it a little suspect for me.
That's interesting.
And so, and it's crazy because my daughter got the vaccine, but as kids growing up, like my son's going to tell you about his experience with vaccines, they didn't get vaccines. And I'm a man of faith, and I know I have friends who are Christians that COVID. My aunt had it, and I think I got a little bit, I lost my taste and smell, but that was it. I was fine. But I really think God uses such things as COVID and throughout history, pandemics, to really shake up the community, and I think people use it to divide, and God uses it to unite. So.
Yeah, and I'm a woman of faith too, by the way. And I did go get mine because the thought of me infecting my grandchildren or the thought of me affecting my brother, give me a shot.
You know, that's right on what you're saying. Right. Because I'm vaccinated. And I actually got vaccinated because I caught COVID. And once I caught COVID, you know, like you were saying, the first couple of days, you know, I'm like, hey, maybe I got a sinus infection or something like that. Well, you know, hearing everything on television, I woke up the third day. I couldn't taste anything, so now I'm panicking. You know, so now I'm panicking like I got COVID. You know, so you know, go in, you take the precautions that you have to take. And once I realized, okay, they have a vaccine for this, same thing he said. I looked in the mirror like I was against it. I didn't even take flu shots, but I'm like, if they got a vaccine for this, the way I'm feeling, I'm taking it as soon as it's available. And even though you said you can still give it to another person, I actually caught it again, and it was more like a common cold once I caught it after the vaccine.
Yeah, I never got vaccines growing up. Even those, you know, lesser sicknesses, the measles, mumps, I never got those vaccines, and I was able to.
Didn't you say you were homeschooled the majority of your life?
Not majority, probably 50% of my years. So probably
grade school was
really when I was for the most part did all my homeschooling. In high school and middle school, I went to public schools, but you know, not growing up with vaccines. That, you know, it kind of just brings COVID into the situation. COVID isn't an outlying situation where I'm pro-vaccine, but you know, anti-COVID vaccine. That's not the case. I'm, you know, across the board. I never was taking vaccines growing up, so this is just another vaccine that came along that would have been something that, you know, I wouldn't have gotten.
Okay, well, I realize that, and I've been told because I'm a public official, I need to be careful, because people ask me all the time, and I tell them to get all the information that they need to get.
At the end of the day, I realized that I took a flu vaccine shot in elementary school. I believe it was mandatory. I think that they used to send a letter home saying if you hadn't had it, you know, you can't return without it. And the Tuskegee experiment was in 1930. It ended in 1970. I was born in 1975. So when I was born, it had ended. I'm 46 now. So from the Tuskegee experiment to now, to the COVID pandemic, we have some 46 years, right? Exactly, almost. And so I'm fine. And after I took the flu shot, sometimes I still got sick. So my whole reasoning behind getting the vaccine was just a lot of times we run from something only to realize we've already been there somewhere similar.
My perspective, when the first pandemic came out and they talked about a vaccine was going to be coming along, I was very adamant that I wasn't going to get it. I'm still not vaccinated, and the reason why I'm not vaccinated is because I feel like if I did get vaccinated, I wouldn't be doing it because I feel like it's the best thing for me. I feel like I'll be doing it because of community pressures, and I feel like that's the wrong reason for me to get vaccinated. I do consider it still from time to time for that reason, but the reason I haven't got it because I feel like it was put out too quickly. Cancers and AIDS and all this other stuff have years and years of research, and still no vaccine to prevent them or to help prevent them. But in a matter of months, we came up with a COVID vaccination. We didn't know how the COVID virus even come from. We're not even sure if it's because of bats in China. But so they just created a vaccination just out within clear air. And I trust our doctors that we have in our society, but everybody's human and everybody's have human error. So I looked at it as if as long as I continue to be respectful to my community by wearing a mask and doing all the other things that they say you need to do to help stop the spread and continue to protect myself, I feel like that it will be, almost just as valuable.
He was coaching kids, doing what he's supposed to do, wearing his mask. And he was in ICU for 4 to 5 months. We would go down to the hospital and pray for him outside his room because you can't get in. He was on a ventilator, and thank God that he made it through. But he has a lot of issues still, and we're continuing to pray for him and support him. But when I saw that, with us being in our community, with all of our high blood pressure, our cholesterol, all these other factors, I thought to myself, what's worse, the side effects of COVID or the side effects of the shot? So that's how I weighed my decision. And when I weighed my decision and I looked at, all right, we got this shot, we got all these other shots. You can't go to Africa without certain vaccines. My kids are in school. They couldn't go in school unless they had their shot records. These are things that we've always been a part of. But when this one came very quickly, of course, we were concerned and we were, worried about that. But
really, to be truthful, in the beginning, I'm like, I ain't taking that. I'm like, I don't know what's in that because of past distrust and history, Tuskegee, Henrietta Lacks, all that stuff weighed in my mind in my decision early on. But then I had to start educating myself, though. And I saw there was a couple video webinars that I participated in, and it was all black folk, right? Like lawyers, like doctors. But the one that really stood out was from the National, Minority Health Institute in California. Had all these researchers, physicians, PhDs, and all of them were black. They looked like me. And they really start rolling out everything behind it. And a lot of folks thought that they just put that vaccine together, but they have been working on that for a long time. Yeah. And then once I started educating myself about it and knew what the facts were, and to Brother Daniel's point, facts don't lie, right? People dying, right? I had to do funerals with folks who were dying from COVID. So it wasn't about me at all, because I felt my immune system was strong enough that even if I did get COVID, I would survive. But what about those who I would come in contact with? And that's really what pushed me, because I owed it to my community and those who, in my sphere of influence, not to allow myself to be one who would spread it.
I actually had COVID-19 back in early spring, back when there was no vaccine last year, and then that there was no real testing either back then. I had a buddy call me and he said, hey, I tested positive, I had some severe symptoms, you should possibly, just a heads up, this might happen. And at first I was like, okay, and then the next few days I went through it. I had some severe body aches, chills, fevers, had some difficulty breathing. And so that's why I chose to get vaccinated. The biggest thing is not only providing protection for myself, is also providing protection to the patients that I see, because I see a lot of different patients and they're coming from all different types of backgrounds. They're also having, some of them are immunocompromised as well. So I want to kind of give the best chance of not spreading this along to my colleagues or my coworkers or even my family when I decide to go home, okay?
Like you said, the misinformation, I think that's a big part of it, because I mean, I think already as a community, as Black people, I feel like, at least me, you know, you almost have something in the back of your head that doesn't want to make you trust authority. Well, why? Because authority to us originated as slave owners and, you know, just being oppressed as a people. So now that we still see, you know, our leaders being majority white people, I think that in itself, I think we have to address and get past that in order to just at least trust these systems a little bit more. In order to trust it's definitely a trust issue. In my generation, that's what I'm hearing the most. It's a trust issue. And whether that, you know, we've definitely come a long way from those days, but there still are, you know, those kind of issues between citizens and authoritative figures.
Like I said, as a community, I just think we need to just continue to educate people and just continue to pass that word. And, you know, don't be afraid to have a conversation with people, because I think that's what it's all about. You know, I'll believe you before I believe a doctor. And that's just the truth about it. You know, I don't think the doctor has my best interest, but if you educate me, you give me some information, then, you know, I'll be more likely to get it.
I was watching on Instagram, which is probably not a great way to get some information, but I was watching on Instagram, and there was a guy who was talking about, hey, we're afraid to take the shot, but you'll go to somebody's house and they'll roll a blunt, and you don't know who licked it. you don't know what's in the weed. Everybody and their mama walking around passing the blunt. We got songs about passing the blunt. We licking everything. And we don't got no issue with what we're putting in our body when we go to McDonald's. We don't got no issue with it. So that made me look at myself and say, hey, number one, I need to be more healthy in life in general. Number two, you know, I don't want COVID. You know, I just don't want it. My mother is a cancer survivor. I don't want COVID to take to her house.
What we have in researchers and scientists and people behind the scenes figuring this out, there's a comfort level for me to say if they came up with this vaccine, you know, and nobody's died from it yet, millions and millions of people have taken it, then I feel like it's a good thing. And they will continue to perfect it. But, you know, then you got the Delta variant. Now today, the numbers are going up again because you've got the other variant, a third variant coming out. And the more that I think we don't get vaccinated, the more we're going to contribute to letting those other variants spread. Or you're going to be so far behind the curve that if you get one of them, it's not going to be a good outcome. So,
and we got to be careful with statistics, because let's say they say 55% of white people got the vaccine, 35% of us did, but there's so many more of them. So many more of them in this country. We only 12% of the population. I bet you it's just as many white people that don't want to get the vaccine, don't trust the government, and all of that. They just ran up in the Capitol. You know what I'm saying? Sometimes it ain't just us that don't believe in the government. It be them two little small white factions in the country, the militias and everything. So, you know, when it comes down to it, they might just be just as bothered with it as us. So it might not be just a Black African American issue when it comes to mandates, following mandates, do I wear the mask or not? I just wanted to add that in there.
Robert and Teresa. But, you know, when my kids were born, we didn't even have to use a car seat.
Oh, wow.
We didn't have to wear seatbelts, and we didn't have to use a car seat.
Seatbelt is another.
And I had this little cheap plastic carrier that I would lay on the front seat and lay my son in.
Oh, he was in the front seat?
In the front seat, not strapped in,
man.
just in the front seat, laying on this carrier. And it was something you didn't even think about, because there were no car seats.
Right.
You know, I mean, everybody carries backpacks. There were no backpacks.
Right.
Well, that's you would know this more than I would about the COVID has taken on this whole political line, and that's unfortunate, because people are dying And I don't think we should use politics to divide, but it happens every day. That's just the realization of how our society is right now. We are divided by politics. You know, so
you have to understand what's happening globally. I mean, we're so focused on the pandemic. Our whole life is about to shift. It's shifting with this legislation that's being passed. This broadband that's coming in, the new infrastructure, it's the new steamboat, it's the new railroad, it's the new interstate, it's what's needed for commerce. The way we're changing these roads to one lane this way, one lane, it is for our safety, but it's also for the autonomous vehicles they're just waiting for the broadband infrastructure to be in. Look at our city's 5G footprint and how it's supposed to be put into our community. Best practice says that 5G small cell towers should be put in industrial locations and along the expressways. When you look at the city's 5G map, it's all over our residential areas. But you need that connectivity for those vehicles to be able to run without drop calls. So I'm saying, while we're focused on the pandemic, so many things are shifting. I mean, we see the power struggle that's in Congress. So I'm saying, I'm not talking conspiratorial theory, but I am saying be aware of everything that's happening. I told people when this started, social distancing is real. My concern is the social conditioning. Now our numbers are about as high as when we shut everything down. Now I love my football, but look how many stadiums this weekend were packed. 100,000 folks. Packed. If we're really concerned as a nation, why don't we shut that down? Money drives everything. And even money is even driving some of the decisions. Hospitals are now mandating that their employees get vaccinated because they don't want to lose their Medicaid payments. You know, a lot of people are dying from COVID because of the money that's attached to it. If you die from COVID, the hospital gets more. So I mean, these things are real. And I'm sorry, for something serious, you don't have $1 million raffle for people to get vaccinated. I mean, take time just to think. This thing is real. I want to reiterate this. This thing is real. But so is the social conditioning that's taking place amongst society. You know, and so we just have to, we need a spirit of discernment. And if you're not vaccinated, then stay connected to your doctors to learn everything that you can do to protect yourself. And if you are vaccinated, still learn everything you can do to protect yourself and others around you.
We make up 13% and we are already underrepresented in the medical field. So it's kind of hard to, you know, it's a little bit difficult in regards to putting the representation out there, and people tend to trust a little bit more when they see somebody or they see a doctor or a physician who comes from a similar background as them. They tend to, you know, listen and kind of apply a little more. You can give them your best recommendation, and you know, from the data that's out there, but ultimately it's going to be their decision, regardless of what the result may be. So all you can do is just, you know, give do your best, give your best recommendation on what you think would probably be the best for them and their healthcare and their course, and just hope that there's no type of detriments that come back in the end. I've talked to family. I have family members who do not want to get the vaccine. I've had family members who believe in conspiracy theories. I've had own family members that died in my own family. One thing that I did bring up, even when I'm just talking with patients, or at least when I'm just talking with family, they tend to bring up the Tuskegee experiment. In the Tuskegee experiment, they talked about it happened back in the 30s. They were purposely injecting black patients with syphilis and lied about treating it, and just watching how the disease actually progressed over years and following that. I've had family members who, you know, weren't really, you know, are very, you know, opposed to vaccinations, or they're believing in different theories or type of aspects to go about. The virus mutates just like it goes through everybody's different body. That's nothing new. But the fact is that you have a prominent strain that's been known to like infect people after it goes through, let's say, 1 million bodies or so, like in this case, then you're gonna have something that might be a little bit more infectious that pops up. COVID affects people that have what we call comorbidities or some type of underlying illnesses. You got high blood pressure, you have diabetes, you know, you have high cholesterol. All those things are contributing to a diet. But at that point, if you're having all those chips stacked up against you and then the virus comes in, your disease process you know, it's gonna be a lot harder for you to kind of get over these things.
We've grown up in this stupid political environment.
And so we know you really have to do your homework. But when you don't listen to all the news, if you don't go to the CDC website, if you don't go to the health department, you're not going to believe. And even the health department here in Summit County. Russ, how long was it before we had to basically force them to make sure our folks got tested? Like the NAACP, we signed up 800-900 people on our phones because they, for some reason, the system, the way it was in the beginning, everybody couldn't get a vaccine. Why? Why? You want to keep everybody safe, that's what you claim, but you make it so hard for people that also added to the mistrust. And so there are a lot of layers to this, but I think what Russ was saying is there are multiple ways of doing it. And it's hard for some of us because I wish I could trust that everybody would wear their mask that wasn't vaccinated. Yeah, they don't do that. See, I said I wasn't going to do that. See, they don't, and that bothers me. You want to come to my house and, you know, eat my food and fellowship with me, but you don't want to wear a mask. Something about that bothers me. What you do is your business. But when it comes into my domain, you either play by my rules or just go ahead and play by your rules out there. And I'm okay with that because it's a personal opinion and there are different ways. There was a nurse who we interviewed for Tamika's panel. Remember that? She said the new moms that come in that don't want to get the vaccine, she said all she does is listen and then tell them about some other things they need to do. And I agree. There are more options. There really are. I just know for me, I'm like you. We're in the public eye all the time. I had to do it.
I am hoping that parents, guardians, families will choose to get their young people vaccinated simply because schools are congregate settings. And I don't know how we provide safe education within a congregate classroom setting without getting some type of herd immunity. If we don't get to a place where we are not spreading the virus from student to student, teacher to teacher, classroom to classroom, I don't know how we're going to provide school.
Yeah.
And I am also not that confident in every parent having the same level of experience as our young person here had in being homeschooled.
Right.
Judy and I have talked a lot about this. There was a year of remote online learning. And I will tell you very transparently that our young people have suffered behind that. And it's going to take us some time to recover from that. So minus getting our young people vaccinated so they can keep their parents, their grandparents, their siblings, our teachers, our principals, our tutors, our lunch ladies, our bus drivers.
Everybody.
safe. I mean, today, there are more than a dozen bus drivers out.
Wow.
So then that means students aren't being picked up for school. So I don't know how this works.
Like when it first came on, the scene, it was basically for elderly and then for people with health problems that they were encouraging to get the vaccine. And then now it's gone down to we're getting a form for our 7-year-old to get it. So my husband and I are kind of like, do we want to do this or what? Like now we're kind of, on the fence about do we want to get our child vaccinated because first it started out as elderly and high risk, health issues, and now they've taken it down to 5-year-olds can get vaccinated. And I'm a little bit on the fence about that.
There's certain vaccines you have to get into schools, daycares, and all those other things as well. And then like we get a flu shot every year for whatever strains or variants of the flu that might be prominent that year, so it's kind of best predicting and how to so it gives us the best idea of how to prepare ourselves for that flu season that comes about. This is just another implement with COVID-19.
You guys are such a part of our community, and I know some of the work that Robert has done at the chamber. He's worked very hard to make sure that the people who come into shops, barbershops and salons are engaged in these conversations and in this process, because it's really important. And so he gets, I know I send, stuff to him and say, shoot this out for me, because he keeps sort of a list of, making sure he can push information out. Sometimes I may get an email from someone else in the community, another nonprofit organization that says, push this out for us. And so, working together in collaboration as a community is really key. And that gets the information out on a broader scale. And the information, I think, is consistent. And so we work with all the major hospital systems, so it's really just pulling in the community as a whole and finding ways that we can educate people, but at the same time, make sure that our people, our community, the Black community, is getting exactly what they need. Because sometimes that's very different. And of course, we've talked about that quite a bit here today, that can be some different things that we need versus other communities. So yeah, and again, it's an ongoing process. We're going to be at this for, I think, a long time to come. But, I always, my term, no money, no mission. I mean, if funding is available, pushing this information out is not free.
Right.
It takes a lot of work, but it's worth the fight.
Hi, my name is Davion, and I'm getting vaccinated so that my family and friends stay.
Drew Engels. I'm a pediatric hand and microvascular surgeon. I was vaccinated because the science supports it, and so has my whole family.
Well, I'm not vaccinated yet, but I'm thinking about getting it. The reason why I'm not, I've been going through treatments, like chemo treatments. And I was just trying to wait and see when is the best time to get vaccinated.
Hi, my name is Tracy, and I did choose to get vaccinated. I battled with it for a while, but the pandemic is so deep and it's not going anywhere that I chose to get myself and my daughter vaccinated so that we can not only protect ourselves, but protect our loved ones and those around us.
My why is I want to protect myself and others.
Because I really wanted to support not only my family when it comes down to being covered and protected, but also when I come in contact with people in the community, with going to the grocery store, or even attending events. I really feel better knowing that I am vaccinated and that I am comfortable being around people that I don't know, because I love meeting new people. So I am really grateful to be vaccinated and hope others will join in.
Well, the reason why I feel like I shouldn't be vaccinated is because I have natural immunity. Because I've already had the coronavirus back in February, so.
Okay, and the reason why I feel I shouldn't be, ditto, but also because there's not enough research, in my opinion. It came out too quick whenever Trump said he needs to get it in before he gets out of office. And then it came up with it that quick. It's not enough to me. It sounds like we're the guinea pigs.
Yeah.
Hi, I'm Shar, and I chose not to be vaccinated because I don't know enough about the vaccination. If I had more information on it to know that it's safe, and for the next years to come that it's safe, I would be down to do it because I'm scared of this COVID thing. But like I said, I don't know enough to actually go and get the vaccination, so I decided not to.
And I think one of the things too that we tried to do, our work at the Akron Urban League, we are a civil rights organization. We are an organization that focuses all of our programming on particularly African Americans. We work with any group, but that's always going to be our focus. And so one of the things that we were very concerned about was access to the vaccine, because we work with a lot of communities who are living at or below the poverty level. And so, do they have a regular doctor? Do they know where to go? Do they have transportation to get there? What concerns do they have? Do they have enough masks? I mean, we held, multiple engagements where, people could come and get, PPE supplies. Because again, it's something that sometimes people don't think about, but everybody can't walk into the store and pay $5 for a pack of masks. They just don't have it. And so, I think one of the things that we try to focus on in the Black community was just, whether you decide to get vaccinated or not, how do we help keep you safe? And how do we give you access to whatever it is that you need to get your household? Because you may have a house with 5 people in it, and they may be 5 adults. I mean, families look very different now than they used to. Grandparents are raising their grandchildren, and so there's so many different variations of households in the Black community that it's something that we all have to be concerned about. Are people able to have access to what it is that they need, and if they don't, what can we do to help that? Well, we can give them information.
Where are our options? So I don't know how many people know it, but today, Stowe Public Schools is closed due to staff shortage.
I spoke with some young kids, and COVID has affected their hopes and dreams of becoming athletes, and they're ready to step up first to take it, saying, I missed my senior year of football or basketball, and I was counting on a scholarship to take care of my family that don't even care about education. So they all have minimum wage jobs. I'm looking at myself, and those kids I'll take the COVID shot in a heartbeat because I just missed my freshman year of football for a full ride somewhere.
The whole social interaction thing was affected by COVID. You didn't, the seniors didn't go to the prom or the homecoming. You didn't go to the football game, you didn't go to the basketball game. You just, everything was shut. We look at that as being minute, but it's major.
Yeah, for sure.
Some of these kids, socially, are so far behind because they just weren't, able to interact with one another. So,
I think there was some good that came out of that.
What?
We got closer with your family.
That is true.
That's true.
That is
That's
true.
true.
More your skill set, more,
That's true. I'm just saying, everybody ain't, catching up with it.
But our young people, they need that socialization because if they're not around people like you who can give them some knowledge, somebody else outside of family, as a grandmother, they half listen to me. But somebody like you could walk in and say the same thing, I see her. And they listen. So they need that. They need to hear it from
reinforcement.
Think about a second grader. Second graders today have never been in school before the start of school this year. Just think about that. Wow. So
I want to speak to something though. I mean, really, in most Black folk, people of faith, and the COVID has shaken up everything. I'm a pastor, so I got to talk about faith. I mean, this is a time right now to search your own heart. Are you gonna die? I mean, kids die every day. Talking about 20-some bodies in the funeral home, and forgive me because I didn't mean my body language was bad a minute ago. Forgive me, please. But there's a man right now. I got a prayer group all over the world, and Joe has orphanages in Pakistan and India, Uganda. That's not what I'm trying to say, but we pray worldwide. And there's a man that's in City High, I think he's at City, could be General, who was brain dead. He was brain dead. And we got to praying, and he woke up the day they were going to pull the plug. And the doctors came and said, we've never seen this before. So there's a faith aspect that COVID really affects that we need to really search our own hearts and really know, do we know God? How he died on the cross, where he rose. So, you use it to build your faith too.
I think we all wish we didn't have to wear a mask. They're inconvenient, they're hot, and I just hate them. However, it's a necessary tool that is able to help stop the spread of what could be a fatal disease or a fatal illness, I'll say.
And you spoke about masks. I totally agree with you. Masks do prevent the spread of COVID, but as a community, I can guarantee you that a lot of our people here, if we had our masks on and we went to certain parts of this other community and walked in, they might feel a lot uncomfortable.
Right.
Because now we got on masks and we were already stereotyped by us. We might do something here. Illegal. Now it's everyone is like, wear a mask. Certain places you can't do that.
You know, for the vaccine to become a mandate, you know, obviously somebody who hasn't taken vaccines his whole life, you know, I wouldn't be for that. And I do think that goes against, you know, really what America stands for. I don't think that's something that should happen. And, you know, I think that would be kind of going against principles that society has been so proud of as far as freedoms. I think that would kind of contradict itself.
Yeah.
Again, I'm going to lead with, I don't know how we do school without some safety precaution that probably will have to be required. I think mandating in terms of a vaccine would be difficult, and if choice is given, then we are going to have to figure out as a community, not just a school system, but as a community, how are we going to educate children? And then who is going to be accountable and responsible to ensure that that happens? Because if there are choices made not to take a vaccine and there are decisions that could follow that say, well, then you're choosing online as an option. I'm not saying that is the choice today, but hypothetically. Well, then you're choosing online education. And what about our children? Then what? And then who is going to be accountable and take on the responsibility to ensure that that happens? We can't have our young people not receiving the knowledge that they deserve. Not that they must have, but that they deserve. So I'm cautious, but I don't have answers about how we provide education. I don't know how that.
This is definitely different. This is not a black issue. This is an everything issue. And this affects everybody. It doesn't care if you're white, black, any other color under the sun, what your religion is, what your sexual orientation is. This virus is undifferentiated.